and record this. And I want to introduce myself and Tessa, and want to, then I'll have her take over. So my name is Melissa. Many of you know me as the fundraising person over at FU. I make sure that we have the money that we need to fund things like our awesome pelvic floor physical therapy scholarship. And that is part of the reason that we're wanting to get more out there about exactly what pelvic floor physical therapy is, and how it can help you. I can attest right now, Tessa is my PT, and it has been amazing. The amount of pain has been so much less. And right now, I'm waiting to get surgery with Dr. Guan, but until that happens, there's been some complications. And so I need to wait a little bit. And until that happens, I needed to find a way to help with the pain. And when I tell you she is a miracle worker, I'm not lying. She really is. And I'm going to be doing a blog post about it soon because it's incredible. Um, for me, it really works, and I'm excited for you guys to learn a little bit more about it and get to know Tessa. And so I guess we'll go ahead and start. I'm really bad at introductions. But Tessa, if you want to go ahead and introduce yourself and tell us a little bit about yourself, and you can start.
Perfect. Thanks, Melissa. So I'm Tessa Matus. I am a pelvic floor PT here in Houston. So I work in private practice at Empower Yourself PT. Um, I love having Melissa as a patient, and I think she's a really good example. We'll talk about this later, but I think a lot of people assume that they have to wait until after surgery or after something happens from a medical or surgical perspective with their endo to seek PT. And I would argue that I have a role in any kind of part of that journey and can be helpful to varying degrees in different parts. And I think Melissa's like a perfect example of that. And like, we've got to get her through until surgery date. But yeah, so I'm a pelvic PT. I love what I do. I see folks of all genders because, yes, we do all have pelvic floors. And I see people for all sorts of stuff: pelvic pain, back pain, hip pain, um, bowel, bladder issues, pain with intimacy, a lot of stuff like that. And I assume you guys all understand that, hey, a lot of folks with endometriosis have one or many of those symptoms, or symptoms that revolve in one of those, categories. So a lot of my clientele have endo and they're at varying parts of their journey. Um, so my goal today, I want to talk a little bit about pelvic floor anatomy, um, and our nervous system, and then talk a little bit more specifically about what I tend to see happen in folks with endometriosis, what I can do to treat that and help that. And I also really want this to be interactive. So if you guys have questions or I'm not touching on something that you want me to talk about, like please holler at me, interrupt me, put it in the chat. I might task Melissa and Allison with monitoring that a little bit and like catch me if I'm going off. This is totally how I geek out. This is what I love to do. And so if I'm talking too much, please slow me down. Okay. So I wanted to start before I dive into my first slide here. I want you to focus on like my person screen, not the green screen. Um, and I just want to show you a model of this is a female pelvis. Okay. Male pelvis looks very similar in a lot of ways from a muscular perspective with some differences, but this is a female pelvis. Okay. And I've got my pubic bone here in the front, right? Sides of my pelvic bones. And then if I turn you around, spine, sacrum, and tailbone back here. Okay. So all of this red stuff that you see on the inside and from the outside, this is all your pelvic floor. Okay. It's a bunch of small muscles that work together, ideally as a unit. And I call it your fruit bowl. Okay. So if we look, sorry, I'm managing two computers here. There we go. Can you guys see the next slide? Awesome. Um, so I call your pelvic floor your fruit bowl, for a couple of reasons. A, it's shaped like a bowl. And inside that bowl sits all of your very important pelvic organs, okay, which is your bladder, your uterus, if you still have it, and your rectum in the back, okay? And it's really not a large space, right? Can you appreciate this is a lot smaller of a space than people realize? Um, and so, if there is something going on with your uterus, your bladder, or your rectum, or with your pelvic floor, which makes up that bowl, it's a really gossipy system. And like one thing tends to affect the next, right? And so, what might start as a pelvic floor issue can manifest as bladder symptoms or bowel symptoms, or what starts as, an endometrial issue at, around the uterus, right? That might affect pelvic floor and surrounding things. So I kind of have to consider that it's a gossipy bunch. Okay. And so if you look to this picture on the left, right, that's just that same picture from above, like I was showing you with the model. But I left a few muscles on this particular picture just so you can appreciate. You can see the back of or the bottom of my back muscles, right, attaching to the back of the pelvis. You can see my inner thigh muscles connecting to your pubic bone there in the front. And so there's just a lot of connections all around this area. Okay. And then that picture on the right is just another visual. If I were to slice you down midway, right, and look at you from the inside, you can see your pubic bone there in the front. And then that whole red strip underneath, that's your pelvic floor. That's like the hammock. Okay. Um, and those are all of those organs in there. Okay. And so that's the pelvic floor. Okay. And I'm a pelvic floor PT because I can assess your pelvic floor a little bit more intentionally and directly than some other PTs. But at the end of the day, like I am still a PT, just like you might think of an orthopedic PT, in the sense that I treat hips, I treat backs, I treat knees, I treat feet. This is just a piece of it. And so, I keep clicking the wrong thing. Sorry, y'all. There we go. So I do have to think about a lot more than just your pelvic floor, because you are not a walking, talking pelvis, right? You're a whole human being. And the way my hips move, the way my knees move, the way my back moves can all influence what's happening at my pelvic floor, at my abdominals, things like that. And so I would be remiss if that was the only thing that I focused on was your pelvis, because we'd almost certainly miss something else. Okay. Now, I want to show you this picture. Okay. And before I point out some things in this picture, I want to talk about what your pelvic floor works as, or what system it works as a part of. Okay. So I think of your pelvic floor like the bottom of your core. And I use a lot of analogies. Bear with me here. I think of your core like a soda can. Okay. So picture a soda can with me. You've got a top and a bottom, right? And a front and a back. And there's pressure inside that soda can. Okay. And for that soda can to be working its best, right, and maintaining its pressure appropriately, I have to have equal and opposite flexibility and strength from all four walls of that soda can to be working best. And so your soda can or my soda can is my deep core system. And so that's my diaphragm or my breathing muscle on the top, which you can see in that picture, that little pink line that looks like kind of like an umbrella. My pelvic floor on the bottom, which is like that bowl. Okay. They're like equal and opposite and they tend to move together. Spoiler alert. And then I've got my abdominals in the front and my spine and my back muscles on the back. Okay. Now, this picture in theory is supposed to be a GIF or GIF, however you say it. I'm not fancy enough to make it move. So we're just going to have to visualize. Okay. So when you breathe, okay, this is just one example, my diaphragm is going to descend and flatten. Okay. And when that happens, right, remember all of those other walls have to respond, just like that soda can. And so when my diaphragm descends and flattens, my pelvic floor ideally should drop and lengthen. Okay. And my abs are soft and the back of my rib cage should move. So it's like almost like 360 degrees. I should get some expansion. Okay. And then as I breathe out, everything just kind of recoils back to its resting position. That's the definition of a diaphragmatic breath. And so you can appreciate, I'm sure you've heard about people talking about breathing or talking about, breath strategies to help manage tension or calm them down. And I know that sometimes can feel like too simple or almost a little woo-woo, but I want this picture to kind of demonstrate that that is very much a physical connection too, right? It's a pressure system. And so the way I move my spine, the way I move my abdominals, the way I move my pelvic floor, and the way I move my diaphragm, AKA how I breathe, can all influence one another, right? And so you can see that that pink line is that diaphragm on the top. You see that pink ball on the bottom, and then spine in the back and abs in the front. Um, so that's kind of from like a mechanical perspective or a musculoskeletal perspective, kind of what I'm thinking about a lot as a PT. Now, I can't forget about your nervous system too, though. Okay, this is something that sometimes we forget about. Your nervous system is your brain, right? Your spinal cord, and all the nerves that come off of your spinal cord. Okay, and this is like my hub. Okay, this is what is perceiving and controlling pretty much everything in my body. Okay, um, and so when I have muscles that tense up or guard, right, that's because my nervous system is telling them to. Okay. It's telling my muscles when to contract, when to relax. It's sensing things in my body. So if an organ hurts, right, maybe because of endometriosis, or if, let's say, someone touches me on the arm, or I fall and break my arm, right, I get sensation cues from my muscles, from my joints, and from my skin and from my organs. And so I would be remiss anytime we talk about changes in a muscle, right? It really changes in your nervous system and vice versa, right? If I change something about your nervous system, I'm probably changing something about your musculoskeletal system too, right? Um, Now, you also have this like automatic system in your nervous system, and it's controlling all the stuff that you don't have to think about on a day to day, right? The stuff that keeps you alive. And this is stuff like breathing, this is digestion, this is heart rate, this is like some sleep wake cycles, things like that. Um, and it's a super complicated system. Like, I can't even begin to get into the nitty gritty of this, but just know that there is this automatic system working kind of beneath the surface that is very much responsible for keeping us alive and like moving during our day to day. And so there's kind of two big systems when we talk about that automatic system. And I bet you guys will have heard of this before. Um, but we have what we call our sympathetic nervous system. Okay. That's like our fight or flight system. So think about this when you are, let's say, about to give a presentation and you're having trouble sharing your screen, right? My sympathetic system kind of elevated a little bit. My heart rate's beating a little bit faster, right? If I'm running from a bear, hopefully none of us have that experience, but like I might have a fight or flight system. Or let's say I fall down and hurt my arm, right? My fight or flight system is going to be elevated because something traumatic or unsafe is happening in my body, right? And so this is going to be activated anytime we perceive a threat, whether that's an internal threat, like a sensation, or an external threat, like a bear chasing us, right? And it's going to increase our alertness, right? We have a big cortisol or adrenaline dump, right? And so I'm laser focused on what I need to be, okay? My heart rate might go up. I might start sweating. I might start breathing fast. And the things that are not important for me to survive in that moment, like digestion or, um, you know, the feeling in my big toe, right? It's going to go out the window because I don't need to focus on that right now. Okay. Now, on the other end, we have our parasympathetic system, which is our rest and digest state. Okay. And so this system is activated. I always clarify this, it's not an absence of threat per se, but rather a sense of safety in the body. And again, that can be safety in our environment or just safety from an internal perspective, right? And what this can look like is saying, hey, I have the time and capacity right now because I feel safe to do those less vital things like have good digestion, right? I might sleep better. I might feel less anxious, right? It's a very calming system. And we tend to have less pain when we have more parasympathetic activity in our body. Okay. And so this is a very finely tuned machine in the sense that we ideally should have a nice balance between these two systems and they should turn on at appropriate times. And they're both always working to some degree, but it's just a matter of how dialed up is one system versus the other. But sometimes this gets a little out of whack, and maybe we have all this sympathetic drive and our parasympathetic system is suffering, right? We have a hard time stimulating it or turning it on. The opposite can be true too, though I will say I tend to see people who have a harder time dialing up their parasympathetic system. Um, so, anyways, those are our big two states, and we're going to kind of come back to what that tends to look like in folks with endo. Okay. Any questions so far? I know that was like a lot of information. All good. Okay. So, with endometriosis, okay, we can have changes to all of these systems, and you probably are already guessing it how. Um, but picture this for me, okay? You're in a flare, okay? Um, and I know that can look a little different person to person, right? But I tend to hear a lot of similar complaints, right? It almost always includes pain, whether that's low back, whether that's abdominal, whether that's pelvic pain, maybe all of those places, okay? Maybe you're really constipated, or maybe you have diarrhea, right? Your period's about to start, so all of your symptoms are worse. And maybe you are laying in the fetal position for 2 days with a heating pad on your belly, or laying in front of the toilet, like resting your head on the seat. And that's what you're doing, right? And your body is trying to protect you because it's sensing all of these danger, danger, pain signals, right? And your body really, really wants to protect you because it thinks that's what's best, right? And I think our bodies are really smart, and this is the way it is for a reason. But then we get tension, right, in our pelvic floor, or maybe in our abdominal muscles. Maybe we stop moving our back because all this movement seems to hurt, and we kind of stiffen everything to guard against it, right? Um, Kind of like, again, if you fell and broke your arm, what would you do, right? You'd hold it really stiff against your body, which is in that situation very appropriate, right? It's protective, it's keeping things still until you go to the doctor, get an x-ray and a cast or whatever, right? But so that happens. But then with someone with endo, right, it's happening over and over and over again. And I hear this all the time, and I'm sure you guys can attest to this too, that like it takes a long time for a lot of folks to get diagnosed. Even once they get diagnosed, it can take a while to figure out a game plan, right? You can wait a year for surgery, right? That can get delayed. You can wait another year for surgery, right? Or maybe you're not eligible for surgery and you have to manage it with other things like birth control, okay? Manage symptoms. But this is happening over and over again. And you can probably start to predict, like, yeah, I'm going to feel this way this time of the month. And so now, when that guarding is happening over and over, our muscles get really tense, they get tight, and my alarm system in my body, my nervous system, becomes really sensitized. Okay. And so now it's easier for that alarm system to go off. Okay. Think of it like I used to have a neighbor who had a really annoying car with a really sensitive car alarm system. And right, normally you should only expect your car alarm to go off if, let's say, someone is actually like breaking your window or like jiggling your car handle excessively, right? Um, their system would go off when someone so much as like touched their car, right? Or like if a squirrel jumped on their car, their alarm would go off, which I would argue is more sensitive than it needed to be. And it, I know, annoyed him and it annoyed us because we kept having these, glaring, disrupting signals going off. So that can kind of start to happen with endometriosis. And then over time, that sensitive nervous system and those chronically tense tight muscles tend to just feed into that cycle of like pain and other dysfunction. Okay. Whether that's now I'm having trouble peeing, right? Or I'm even more constipated, or intimacy is getting painful now. And it wasn't before initially, um, things like that. So it's kind of like this vicious cycle. And it's rooted in our body's protective mechanisms, which I fully respect. But sometimes those mechanisms don't serve us well in the long run. And that's where I kind of come in to help us like break that cycle. Um, so yeah, this can manifest like these changes in your musculoskeletal system and nervous system. It can manifest in a lot of ways. And a lot of these, right, these are symptoms of endometriosis too. And so while those lesions, let's say you have a lesion somewhere near your GI tract, that might contribute to your constipation or your diarrhea. right? If my nervous system is stuck in fight or flight, guess what? My digestion is also going to suck, right? I might have like really hard stools because it's not moving well. Or I might get diarrhea because I'm so stressed out, it's just trying to dump the system, right? But so this is where we can see all of these things can contribute also to the pain we get, pain with intimacy, bowel stuff, bloating, feeling hypersensitive. Like now I can't even touch my belly and it just hurts and it shouldn't hurt, right? I should be able to tap my belly and it not hurt. You might feel fatigued, you might have trouble sleeping, and it all starts to kind of feed in. So, what do we do about it, right? How can a PT help with that? There are so many ways. Um, and if it's not obvious, like if you were to see a pelvic floor PT, right, we would do an assessment and we would help identify, and it often takes more than one visit, but help identify what are the biggest drivers for you. And that might look different person to person, right? Some people, it might be a big nervous system component. Other people, it might be a little more musculoskeletal. It's almost always a combination of both, though. Um, so we address what we find, right? Let's say we have muscle dysfunction and we have a really tight, non relaxing pelvic floor. Okay. Um, I first have to just build some awareness of what my pelvic floor is doing. If I'm chronically holding it tense, right, which is really not a functional position, right, that can contribute to pain. Okay. It also makes it really hard to poop or pee if my pelvic floor is always tense. And it can also lead to a lot of pain with intimacy, especially penetrative activities. So, building some awareness of where is my pelvic floor in space? What is it doing? How do I let it go? How do I contract it and also let it go, right? Can I lengthen it even further? Things like that. We use a lot of manual therapy or hands on treatments to help manage any like trigger points or hyper irritable areas and muscles. We might send you home with stretches, almost certainly send you home with stretches. Things like happy baby, stuff that will open the pelvic floor area, soften the belly. And I'll probably be teaching you, no, I won't probably, I will 100% be teaching you how to diaphragmatically breathe. Okay. This is like, I don't care who you are, most people benefit from this, and it's a hard thing to learn for most folks. So I don't care who you are, like you 100% will be taught this. Um, but learning how to expand the rib cage, right? Move the spine so that my diaphragm can move well so that I can relax my pelvic floor even more. Um, there's also other tools that I use a lot. Melissa, I might use you as an example, but there are things like dry needling. Okay. This is when we use almost like Melissa's about to chime in. Dry needling is something I use sometimes to really tense tender muscles. I personally do it mostly around your hip musculature or like inner thigh area. There are people that can like dry needle your pelvic floor. I just haven't been trained in that, so I don't do that, but that does exist. Um, but dry needling is essentially like it's an acupuncture needle. Okay. It's a really thin little filament needle, and it's different than acupuncture in the technique. So we use it almost to create like a little local inflammatory response. Um, Almost like I liken it to like popping a pimple when you're a teenager. So if you have like a really angry pimple on your face and it hurts, um, you go in and you pop it, which you're not supposed to do. Don't tell your dermatologist, but you pop it and it hurts more. And then it kind of is sore for like a day, but then the pressure is better and it feels better overall, right? We kind of do that with the hyper irritable spots in your muscle in the sense that we kind of disrupt them and it can hurt a little bit more in the moment. You might be sore for like a day, but then the idea is that it helps normalize tension overall and helps your nervous system kind of like chill out a little bit. Cupping, if you've ever seen, I feel like Michael Phelps made it really popular. He'd walk out with like those big round bruises on his back. I don't do the version that you get bruises, but I do use little silicone cups that you can get for cheap on Amazon or online. And it creates a little bit of suction, and we move it around the belly or around the inner thighs or around the back. And we're just promoting blood flow, kind of again, helping desensitize that nervous system. So that can be really pain reducing for a lot of folks. Gua sha, in a similar sense, I know people got really this is a very, very old technique. I won't claim that it's new in any way, shape, or form. I feel like it got popularized in the US in recent years, with people doing it to their face. But same idea, I can kind of interact with your tissues in a lot of different ways to help calm them down and desensitize them. And so we can use little like metal tools. I keep motioning to my face, but we would probably be doing it around your inner thighs or back or low belly, things like that. Um, so yeah, I'm sure I'm missing something on this list or a thousand things. But just know we have so many tools in our toolbox to address a muscle that's tense and tender. Um, Now, let's say though that those muscles are tense and tender because my nervous system is on high alert. We've got to address that too, right? And so that's where, if we look at this white box, calming the nervous system, we can do that in so many ways. Again, diaphragmatic breathing, it's a theme and it's there for a reason. There is so much research to show that the way we breathe, it stimulates our vagus nerve, which I'll talk about here more in a second. I bet you've heard of your vagus nerve, but it can be really calming for the nervous system. And there's a lot of different techniques out there, but like if you're feeling really stressed, taking a few slow, deep breaths for most folks can kind of help bring heart rate down, bring nervous system down, regulate things a little bit better, and decrease any sense of anxiety or decrease sense of pain, stuff like that. So we come back to that all the time. Meditation is a simple one. I say simple, meditation can feel really hard. But there's lots of, I mean, I have folks who do all sorts of stuff, right? They have their own practice, or maybe they follow an app like Headspace, like something to kind of guide what's happening inside the head. Coming back to the vagus nerve, right? So diaphragmatic breathing is one way to stimulate it. Just by like a thumbs up or thumbs down. And I'm trying to look here. Actually, I don't know if anyone has their camera on. But just looking for feedback of like, have you guys heard about your vagus nerve? You can put it in the chat too. Oh, I'm looking at the chat. Yes. Oh, Allison, I'm just seeing your try needling comment. But so your vagus nerve, this is something else that I think has gotten a little more attention in the wild in the last few years. I feel like we've been talking about it as a profession for a little while, but like there's more and more research coming out. But your vagus nerve is a big controller of your parasympathetic nervous system, meaning that rest and digest state. So, in simple terms, when I stimulate that nerve, which runs kind of from like the base of the skull down through the neck, under the collarbones, and then down to lower parts in your body, when I stimulate that nerve and work on the muscles around that nerve, it kind of dials up that parasympathetic activity. Okay. So it helps increase my sense of safety in the body. And Melissa, I'm sure, can attest to this. Like, there have been a couple days that I've seen Melissa and we're just kind of in like fight or flight mode, right? Like everything hurts
Yeah.
in, pardon my French, a shitty week, right? And
It's
I don't
horrible.
know where to start because this hurts and this hurts and this hurts and this hurts. And the answer there isn't to play whack-a-mole and just like, start one spot and like work on this painful area and then move around. In my mind, that screams, hey, my nervous system is doing this. And if I can calm that down and put out some of those fires in the body, maybe I can better identify, okay, what is actually driving symptoms right now. And so there have been days where like we have literally like turned off the lights in here. I like turn up the sound machine. It's like I try to emulate a spa if I can. And we're just doing manual work, like massage and stuff around the base of the neck, right? Or maybe around the collarbone. And I'm having her think about things and deep breathe, and her body's in a comfortable position. And she's certainly not the only one that I've seen this work really well with. My folks who have a lot of chronic issues, like it's not the end all be all, don't get me wrong, but like it can go a really long way to just calming the system. And it can feel magical. It's not really magical, but it can sometimes feel a little magical that like, wow, like your back stopped hurting as bad just because of what I did up here, right?
And no, Tessa, it is magic. I've already told you.
I'm trying to emphasize that we are evidence-based in this practice, Melissa. Thanks very much. um, but yeah, no, it can very much feel magical. But yeah, and so that's one way we can kind of dial up that sense of safety in the body. I can also teach you stretches to do at home. This is we're talking about sleep is also really important because if I don't get it, that's like one of the basic things. If I am not getting good sleep for one reason or another, right, the whole system's going to suffer. And almost everybody, I think anybody who has chronic pain can attest that when their sleep decreases, right, or it gets crummier, or they wake up more in the night for whatever reason, their pain tends to be worse, or whatever symptoms they're having tend to be worse. That's pretty well documented. Same thing with like diet stuff. Not to say you have to be following a regimented diet, but in the general sense of like fueling your body and nourishing your body, right? You might have specific dietary triggers, but like if I'm fueling my body appropriately, that can really help my nervous system too. Um, the other point on here is I say consider the narrative in your brain about your pain. Um, and this is something that's I kind of work on to an extent in my practice, but I often will pull in other professionals to help with this too. Um, but our emotions and kind of the narrative that we tell ourselves about what we feel in our body can go a long way in changing what we're actually perceiving. And I don't want this to sound like, oh, it's all in your head, because none of this means that. I fully validate like you feel what you feel, and your pain is very, very real. But pain is also at its root, it is a perception, right? That is like the definition of pain, basically. And so, like, picture this like if you're, let's say you work in corporate America and you have a big presentation in front of like 500 people, okay? And let's take person A. Let's say that they're approaching this presentation and they're like, I am so excited. I got asked to present on this. It's going to advance my career. I can't wait to show off my growth. I can't wait to show off what I'm going to talk about. This is such an exciting opportunity, right? They might still have some fight or flight going on just because they're in front of 500 people, but like it's going to be a good kind of stress, right? Um, but now let's take person B who's doing that same presentation, but let's say the context there is that someone from their team had to present and they drew the short straw and they didn't really want to present in the first place. And they have a lot of anxiety about public speaking. And they're like, I'm really afraid if I bomb this, like I'm not going to get a raise this year. I'm not going to be put up for this promotion. Like they're panicking about it, right? They're gonna have a much more heightened, like, sympathetic response. Like, they are probably going to be if we dialed up person A 10%, we dialed them up probably 80%, right? Um, and so I think that's just a good example that, like, the same activity with different mindsets, different contexts, different environments, like, can really change our perception of things. Um, and then the last thing on here that I have is, like, we modify what we have to, right? Because I think I hope it's obvious that I cannot change your endometrial lesions, right? I cannot remove them. I can't really change your hormones, right? And so I can't cure those things in the sense that perhaps excision surgery can. Okay. Um, and so while I can't do that, and while we're either waiting for the thing that will help us more, or even if, let's say, we had surgery and like, man, I'm still having some symptoms, like we might have to modify some things that you're doing to make it work best for you as we kind of piece through all of this stuff. And that can be everything from, what position are you intimate in? And can we make that better so it feels better? Right? How do I poop on the toilet? Right? Like, what's happening in my body then? If you're really constipated or you have diarrhea, like, are we using stools? What does our breathing technique look like? And let's say you do something like, let's say you're really active in exercise and you lift weights and you're like, man, I do notice my symptoms flare after I do X, Y, or Z. We look at that and we say, what could be contributing and how can we adjust that? And it might be a position change, it might be how I breathe, it might be the weight I use, all sorts of stuff. Um, and this is just like I'm skimming the surface. We get really creative here. So if there's something here or not on here that you're like, oh, I've heard about this, ask me because I probably just forgot it. Um, okay. I think, oops, I think that is all I've got. But I really want to open this up for questions. And if there's anything I didn't touch on that you want me to touch on, or something that feels unrelated, like holler at me. I want this to be productive for y'all.
Thank you so much, Tessa. Really, really appreciate you. That was awesome. And again, if you guys have questions, you can put them in the chat. You can unmute yourselves, I think. But please ask whatever questions you might have.
I have a question. Tessa, so one thing that I imagine a lot of people going into pelvic floor PT would be worried about is the pain with like the internal work, the pelvic exam. Like, can you talk a little bit about what to expect in a first visit? Because I know, like, when I go to the gynecologist, especially before I did PT, before I did excision, that was really painful for me. I know that it's really painful to have a pelvic exam for a lot of us. So, can you talk a little bit about that?
That's a really good question. So I'll say this at first. Everything that we do, like, it's all with your consent and it's all within your comfort level. And so while there are things that ideally I like to assess, there's a lot of different options for how we do that. And I will never ask you to do something that you're not comfortable with for whatever reason. Okay. Um, Typically, like, let's say I'm assessing your pelvic floor. Okay. I might assess via touch on the outside because a lot of people will have tension in this first layer of muscles. And I can feel a lot of those muscles from the outside, right? And even back and through here around, like, next to the anus, I can kind of get, for lack of a better term, in your butt crack, and feel some of those muscles back there. And I'm looking for tense or tender spots that might point me to where the muscle dysfunction is. And so there is an element of, like, I do want to try to find your pain. Um, but my point isn't simply just to press on something that hurts. But if it hurts because it's tense, then, like, we find a line of, hey, how much can I work on this muscle? How can we tolerate it? What other strategies can we pull in, like diaphragmatic breathing or nervous system calming, to help us tolerate it better? Because I think in the long run, working on this will improve pain and decrease that tenderness, right? And so that's if we're working externally. The same is true if we want to check in internally, which ideally I like to do, especially if you're having, like, issues pooping or like pain with intercourse, stuff like that. That is usually via one gloved finger through the vagina. I can also go via the rectum. I know that sometimes feels a little scarier for folks, but sometimes I think depending on where your symptoms are, right, you might prefer one over the other. And depending on where your symptoms are, I might suggest one over the other. But I'm essentially just trying to gently press these muscles. And again, I'm very much watching and listening to your feedback. My goal is never just to, like, poke on something that hurts without purpose. Um, Typically, like, we can find, like, let's say that's really, really tender. How do I do this? Right back here, right? I might work on this area for a little bit in session and keep it below like a 5 out of 10 intensity. And that's your scale, not mine. And I'm checking in with you saying, hey, is this feeling better as we go? Okay, what about when we integrate that breathing strategy we talked about, right? And then usually for most folks, by the end of the session, it's like, oh, that does feel a little bit less tender, right? Sometimes it takes multiple sessions, but um, there's a lot of options like that. And if you're like, hey, I do not want your hands anywhere near my pelvis, right? I can talk you through ways that you can check for yourself, whether it's in the session with me, whether it's at home, whether it's with a tool, like sitting on a towel roll for feedback. Like, there's so many options. Does that answer your question?
Um, I also wanted to bring up, and I figure that Tessa, maybe you can touch on this a little bit. It's really important to be honest about the pain that you're in. That's something that I think a lot of us have. Uh, we try to mask our pain, and this is not the time to do that. And I had a lot to learn about that.
I'm going to poke some fun at Melissa again. So she's an example of someone who we'd be working, like, let's say we're working on her abdomen. And I'm always verbally checking in with people, like, how's this feel? And she'd be like, fine, with like her whole face scrunched up. Her voice is high pitched, like literally her teeth are gritted. Her toes are doing this. And I'm like, are you sure that you're fine? Because this looks like it's really painful in your body. And I feel like I need to back off here. And then we check in and she'd be like, oh, yeah, you're right. I'm just gritting my way through pain. And so I never want to push through. Like, if I'm ever pushing you to a point that you're going back into that guarding response, it kind of defeats the purpose of anything that I'm doing. And so with Melissa, I was like, we have to bring some awareness here, because if we don't, I don't think this is going to get as much better as it could, because we're just like reigniting that fight or flight system, right?
Yeah.
So yeah, I'm glad you mentioned that.
There is another question. Should I, in the chat, should I still come to a PT appointment if I'm in a flare up?
Totally. I think it's obviously up to your comfort level. Like, if you're seeing a PT in person and you're like, I cannot imagine schlepping my way into the office, like, I won't fault you for not wanting to come in. But I also think that can be an opportunity to kind of work on, especially like the nervous system calming stuff. And it can be a good reminder of like, right, I talked about how when we're in a flare, like all of the guarding that tends to happen and how we get really stiff. And coming in and trying to like interrupt that while you're in the middle of it can go a long way. And we might just choose extra gentle techniques that day. Like, man, we just do a lot of cupping stuff or really light hands-on stuff. But yeah, I can almost always, also a lot of nervous system stuff. I have a lot of folks, whether it's endo related or other chronic pains, if they're able to come in, I'm like, please come in and let me help you feel better. And it can also be a good demonstration of like, oh, okay, this is how this works in real time. Like, this is some of the things that I can do, so that ultimately my goal is, hey, when you're in the flare at home, what are the things that you're thinking about doing to help minimize the like downstream effects of your endometriosis, right? That makes sense?
I had another I had another question. Kegels. I know I hear that word a lot, and I guess I want to ask about it because a lot of people say, you should do them, you shouldn't. But I know it depends on the person, and what exactly is one, and when is it beneficial?
That's a good question. And I realized just now that I feel like I accidentally skipped over my little part of the spiel about like pelvic floor contract versus relax. So thank you for pulling this back in. So your pelvic floor, oh, sorry, there we go. Sometimes it falls apart. So your pelvic floor, right? It's like that hammock, okay? When it contracts, which is also called a Kegel, okay, that whole hammock lifts and shortens, okay? And that's going to happen whether we want it to or not. Like, when I go to lift something really heavy and I need a little more support, right, around my pelvis, my pelvic floor under normal circumstances should contract a little extra. If I'm trying to make it to the restroom without peeing my pants, right, I might be contracting my pelvic floor to help kink my urethra and keep pee inside. Holding a fart in the elevator, right, that's a pelvic floor contraction, okay? Orgasm, right, often involves rhythmic contraction of the pelvic floor. So that's what a Kegel is, okay? And then pelvic floor lengthening is just the opposite of that, right? It's the ability to relax from the Kegel, and also my ability to lengthen a little bit more, which I need for things like if I have to push a little on the toilet for a bowel movement, right? I need my pelvic floor to open more. 30 years ago, right, pelvic floor PT, I think, was way more Kegel centric. And you'd see magazine things about, oh, just do your 100 Kegels a day and that solves all your pelvic floor issues. We know that is 100% not true. And I would bet money that pretty much anybody I meet with endometriosis, I'm open to being surprised, would benefit first from learning how to lengthen and relax their pelvic floor. There's almost always a tension and guarding component just because of the nature of what you guys deal with. And so I will say this. I think the ability to contract and lengthen your pelvic floor is something that everybody should be able to do, no matter who you are. It's not like I don't want folks with endometriosis to have weak pelvic floors or ones that can't contract. That's not my goal. But a pelvic floor that's always up here, right, is inherently kind of a weak muscle, right? Because it can't move through its desired range of motion. And so I always say we have to lengthen first, no matter what. And then we can assess, hey, is there a strength deficit here? And is that causing us issues, right? Is that contributing to other symptoms? So what I see a lot of times with folks who I'm working on, we call it down training, like relaxing the pelvic floor. We might start really heavy in the breathing and stretching category of treatment. But then eventually, once we understand that and get better at that, then we might work more and more on, okay, when I contract my pelvic floor, can I let it go? Can I get back to that new baseline I've created, and use that full range of motion, right? Because folks with endo very well, like if you're lifting 200 pounds at the gym, right? I need my pelvic floor to be strong. And so we might just have to work on the awareness piece and the ability to let go piece after that. So there can be a place for it in the big picture, but I would, yeah, bet money that 9.9 times out of 10, nobody with endo should just like do Kegels and expect that to fix any issues. If anything, it would probably make it much worse, because that's already our issue, right? Does that answer your question?
Yes,
Here's
yes,
my
definitely. One more, because I know that this is something that has I've been, I think, doing well at, but I think
Mhm.
it's important to talk about the importance of at-home exercises that your pelvic floor PT might give you.
Yes, here's the thing. I sometimes have folks come in who are like, I think delayed coming to see me or coming to see another PT because they were like, I just know you're going to give me a ton of homework and I just don't have the capacity for that. And that's very real. And I never want to give so much at home that like that's the barrier, right? There's no perfect program for anybody. And for one person, the perfect program might be I literally have 2 minutes a day that I focus on this, and that's all I can give. And it does help, right? The next person might be like, I want an hour worth of stuff every day because I am like, I have the time and I have the energy and I have the desire, right? Neither is right or wrong. It's just life. Um, I will say though that I wouldn't expect seeing someone like once a week with doing nothing at home. While you might see some improvements, and I would hope that you would, it's going to be much more subtle and probably a little slower going than if you did even a little something consistently day to day. Because we've talked about how this is all a cycle. And the only way I can kind of break a cycle is to interrupt it over and over and over again. It's, kind of like if you trained your dog, right? You don't just like teach them the command and reward it once or twice, right? You got to do it over and over consistently. And so, kind of breaking those pain cycles or breaking whatever cycles we need to break, like it does tend to have to be a little more consistent. But I work with you and we figure out a way that that feels doable.
Well, thank
Good
you
question.
so much, Tessa. If Are there any other questions before? Oh, go ahead, Alice.
Okay, I'd like to go ahead and plug our scholarship program again. For those who don't know, I'm Allison. I am the president of the Endometriosis Foundation of Houston. And we are doing what I think this is our third round of scholarships at this point. So we're going into our third year of offering basically us paying for treatment for you. So please go to our website, apply for that scholarship. Let me see. I will drop the link in the chat, but it's efhou.org/healinghou. Tessa is going to be our PT who you will be seeing. We are going to be paying for 2 different people to see her 12 times. So that is almost 12 hours with Tessa, one-on-one, working with you to help you manage your symptoms, downregulate your central nervous system, all of the things that she talked about today. And then we will also be paying for 1 person to see Bianca Asteris for mental health therapy. So please be sure to apply for those scholarships. Whether you think like, oh, there's somebody who needs this more than me, apply. Because the more interest that we have in this program, it helps us know, like, do we need to offer more scholarships? Is this what y'all want to see? Is this what you want us to be doing? So please, I really encourage you to apply so that we can help all of you, or as many people as we can, access the treatment that they need. So I'll go ahead and I will drop that link in the chat. We will be accepting applications through the end of the year. And then we will announce who is going to be our recipients in like mid to late January.
And Allison, they can also go ahead and get that link if they're on our Facebook page, Endometriosis Foundation of Houston. If you're part of our group, Houston Area Endometriosis Group, and on our website, efhou.org. So, please feel free to go to any of those places and ask any questions you might have about the scholarship and how to apply. And again, like Allison said, the more people that apply, the more money we can raise for it and the more people we can help. And I can attest, especially if you're someone who's waiting for surgery, if you can't have surgery, if you just need help, I can't begin to explain how much this has helped me. So it's incredible. So thank you so much, Tessa. We appreciate you being here with us. And we appreciate you answering all of our questions and doing this presentation. And thanks everyone for joining us. And we will see you again soon.
Thanks so much, Melissa. It's been a pleasure.